The heart is basically a conical hollow muscular organ situated in the middle mediastinum, enclosed within the pericardium, pumping blood to various parts of the body to meet the nutritive requirements. Now, the adjective is cardiac by the Greek name or coronary from the Latin name. It is placed obliquely behind the body of the sternum and the adjoining part of the costal cartilages, so that one third of it lies to the right and two thirds to the left of the median plane. The direction of blood flow from atria to ventricle is downwards, forwards, and to the left. Heart measures about 12 to 9 centimeter into 9 centimeter and weighs about 300 grams in males, 250 in females. Right? This is the how the heart is being placed. External features: the human heart has four chambers, right and the left atria, and the right and the left ventricle. The atria lie above the ventricles and the surface of the heart. They are separated from the ventricles by the atrioventricular groove. The atria are separated from each other by the interatrial groove. The ventricles are separated from each other by the interventricular groove, which is subdivided into an anterior and a posterior part. Right, so this is the nice images of the human heart. The heart has an apex directed downwards, forwards, and to the left side. It has a base or a posterior surface directed backwards. It has three surfaces: the anterior or the sternocostal, the inferior surface, and the left lateral surface. It has borders. The surfaces are demarcated by an upper border, inferior border, right border, and a left border. Here. Now, very important surface marking of the borders of the heart. Point 1, at the lower border of the second left costal cartilage. I think left costal cartilage can be easily identified because it is lying at the sternal angle. That's about 1.5 centimeter, 1 to 1.3 from the sternal margin. Point 2, third right costal margin. This is your upper border. Point 3, fourth intercostal space, 3.8 centimeter from the median plane, around 4 centimeter, depicting the right border. Point 4, lower border of the sixth right costal cartilage, 2 centimeter from the sternal angle margin. Point 5 is the apex of the heart, very important, in the left fifth intercostal space, 9 centimeter from the midline. Joining of point 1 and point 2 forms the upper border. The right border is marked by a line slightly convex to the right, joining points 2, 3, and 4. The maximum convexity is about 3.8 centimeter from the median plane in the fourth space, and the inferior border is drawn by joining points 4 and 5. The left border is marked by a line fairly convex to the left, joining points 1 and 5. The atrioventricular groove is marked by a line drawn from the sternal end of the third costal cartilage to the sternal end of the sixth costal cartilage. The area of the chest wall overlying the heart is called the precordium. Now, coming to the grooves and sulci. The atria separated, so the atria separated from the ventricle by a circular atrioventricular or the coronary sulcus, which is divided into an anterior and a posterior part. The anterior part consists of a right part and a left part. The right half is oblique between the right auricle and the right ventricle, lodging the right coronary artery over here. The left part is small between the left auricle and the left ventricle lodges the circumflex branch of left coronary artery. The coronary sulcus is overlapped anteriorly by the ascending aorta and the pulmonary trunk. The interatrial groove is faintly visible posteriorly, while anteriorly it is hidden by the aorta and the pulmonary trunk. The anterior interventricular groove is nearer to the left margin of the heart, running downwards, and to the left lower end of the groove separates the apex from rest of the inferior border of the heart. The posterior interventricular groove is situated on the diaphragmatic or the inferior surface of the heart. It is nearer to the right margin of the surface. The two interventricular grooves meet at the inferior border near the apex. Here. The apex of the heart. It is formed entirely by the left ventricle directed downward, forward, and to the left, and overlapped by the anterior border of the left lung, situated in the left fifth intercostal space, 9 cm lateral to the mid-sternal line, just medial to the mid-clavicular line. In living subjects, pulsations may be seen and felt over this region. In child below 2 years, the apex is situated in the left fourth intercostal space in the mid-clavicular line. Right? So, normally the cardiac apex is on the left side. In a condition called dextrocardia, it is on the right side. Here is this condition called the dextrocardia. It could be part of situs inversus, in which the thoracic and the abdominal viscera are mirror images. So this body has been dissected by me. Yeah, that's me over here. And this is the case of dextrocardia along with complete situs inversus. So you can see these are the lungs, this is the heart, this is the liver placed on the left side, the stomach on the right side. It was a total case of total situs inversus. You can see over here. Right. Okay. So this is the spleen in the right hypochondrium. And if you can identify, this is the stomach lying on the right side. Sorry, on the left side. Right? It is the liver is seen in the left hypochondrium. You can see the liver over here. Now, after this, let's talk about the base of the heart. It's also called the posterior surface, formed mainly by the left atrium and part by the right atrium. In relation to the base, one can see opening of the 4 pulmonary veins, which are opening into the left atrium, and of the superior and the inferior vena cava, which is opening into the right atrium. It is related to the base to T5 to T8, lying in the lying down posture, and descends by 1 vertebra in the erect posture, separated from the vertebral column by the pericardium, the right pulmonary vein, the esophagus, and the aorta. The aorta is the esophagus. This is the base of the heart. You can see separated by the esophagus over here. The borders of the heart. Upper border is slightly oblique, formed by the 2 atria, chiefly by the left atrium. Right border is more or less vertical, formed by the right atrium extending from superior vena cava to the inferior vena cava. Inferior border is nearly horizontal, formed mainly by the right ventricle, a small part near its apex formed by the left ventricle, extending from inferior vena cava to apex. The left border is oblique and curved, formed mainly by the left ventricle, partly by the left auricle over here, separating the anterior and the left surfaces of the heart, extending from the apex to the left auricle is this left border. Surfaces of the heart: the anterior or the sternocostal surface, formed mainly by the right atrium, right ventricle, partly by the left ventricle and the left auricle. The left atrium is not seen on the anterior surface as it is covered by the aorta and the pulmonary trunk. Most of the sternocostal surface is covered by the lungs, but a part of it that lies behind the cardiac notch of the left lung is uncovered. This is the lung percussion, called the area of superficial cardiac dullness. The inferior or the diaphragmatic surface rests on the central tendon of the diaphragm, as you can see, formed in its left 2/3 by the left ventricle and right 1/3 by the right ventricle, traversed by the posterior interventricular groove and directed downwards and slightly backwards. The left surface, formed mainly by the left ventricle, the upper end of the left auricle. In the upper part, the surface is crossed by the coronary sulcus, related to the left phrenic nerve over here, the left pericardio-phrenic vessels, and the pericardium. The crux of the heart is the meeting point of the interarterial, atrioventricular, and the posterior interventricular groove. Right. Now there are two types of circulation: systemic and pulmonary. It's the pulmonary circulation, blood vessels in the lungs, right atrium, left atrium to left ventricle and right ventricle, whereas systemic, blood vessels of the head, neck, upper limb, blood vessels in the trunk and the lower limbs.